Okay. Oh, and okay. Okay, so I was talking to Dr. Eva. I've never done a YouTube live before, and I hope someone is here viewing us, but whether or not you can view it after, I wanted to take an opportunity and bring on Dr. Eva Keen. I've known her for a number of years now, and she's someone who's so extremely special in my life because, as some of you might know from watching my videos, I became a first time mom in my 40s, and it was really through an article, excuse me, an article I read that Dr. Eva had put out that I felt like was so pivotal. It was a big paradigm shift in my life. I was sort of like, oh my gosh, I waited too long, maybe. You know, that's how you're made to feel when you're in your 40s and trying to have a baby. I waited too long, and I was having a lot of sleepless nights and trying to figure it out. And I wasn't ready to, do IVF and all that. So she put out this article that I can easily say it changed my life. And it really changed um, how I kind of approached my body and this whole fertility journey. I made some pretty big changes, and Dr. Eva can talk about it a little bit more, just about preconception care. That's what she really taught me about, and that you can improve your egg quality and your partner can improve his sperm quality. And it's so imperative to do that when you're trying to conceive. So she's been she's become a dear friend to me, but really, I feel like helped me so much in my fertility journey. And I was able to get pregnant. I had my beautiful daughter at 42, and Eva has helped so many couples that I'll speak for her in this instance, that I feel like we're at the end of their rope. And if you go to her website and look at success stories, I mean, these are couples who, maybe just like you, have tried everything and just feel like maybe it's just not, it's not meant for me. And they meet her and her team, and um, they give them another opportunity to really improve their health and hopefully conceive and have a healthy baby while restoring their own health and maintaining their health. So Eva, thank you for being here.
Thank you for having me, and thank you for the introduction.
You're welcome. So what I wanted to do on this stream is that I learned that you have created a fertility masterclass, and it is a free masterclass. And we were talking a little bit about it, and it sounds incredible what you have put together. But can you talk a little bit about what the masterclass is about?
Sure, absolutely. So we created Optimize Your Fertility Masterclass, which has been months in the making, and you are going to gain some incredible insights about a new approach that can really dramatically improve your fertility. You'll learn about the differences between the NFP fertility optimization approach and traditional mainstream infertility treatments. Excuse me. This system is both science and evidence-based, and it's proven by the success stories of our clients with hundreds of pregnancies, and we'll share some of these with you in the masterclass. We will also show you why this cutting-edge system works and the science behind it. And also you will be able to watch videos and testimonials of dozens of real-life case studies of couples who use this system and gave birth to their healthy babies. And I can say with 100% confidence that you'll find this information groundbreaking and invaluable. Simply by watching the videos online, you're going to get easy to understand, actionable information on exactly how to find out what is affecting your fertility and what you can do about it. Now, I don't know what your fertility journey has been like up until now. Perhaps you and your partner have only recently started trying to conceive, or maybe you feel like you've tried everything for what seems like an eternity and nothing's worked so far. Perhaps you tried IVF multiple times and it didn't work for you and you don't really want to do it again. The fertility challenges you're having may have nothing to do with your physical reproductive system, and they may be caused by other factors that are outside your reproductive system and are adversely impacting your ability to conceive. So today I'd like to share 5 out of the 15 fertility factors impacting your fertility that most doctors either miss or only recognize in part, or address without getting to the root of the problem. And you may be surprised to learn in the masterclass series that 11 out of the 15 factors are not even part of the reproductive system. However, they greatly impact your ability to conceive and carry baby to term. So let's start. The first factor is the immune dysfunction. Now, many people are surprised to learn that the immune system can cause problems with fertility. They're also surprised to discover that immune dysfunction can cause issues such as endometriosis, Hashimoto's thyroiditis, asthma, and eczema, all of which can impact fertility. Studies show that issues with the immune system that affect the reproductive system is a serious health issue involving approximately 1 out of 5 couples at reproductive age, which is, a big number. The second factor is the digestive function. Now, when trying to conceive, it's essential that your digestive system is functioning properly. Your digestion is where all your food and nutrients are broken down and assimilated to be transported to all the cells in your body. If your digestive system isn't functioning correctly, it doesn't matter how many fertility-friendly foods and nutrients you consume, because your body will not be able to utilize them properly. Healthy digestive function is vital to the production of healthy eggs and sperm. And here I'll share also 5 reasons or indications as to why your digestive system may not be functioning properly. 1 is antibiotic use. We've all taken antibiotics at some point in our life. Parasite or opportunistic bacteria, sugar consumption, poor liver function, and your genetics. Now, the third factor that impacts fertility is infections and inflammation. Now, this factor is not often associated with fertility and can often be a hidden or symptomless cause. A 2009 article found that inflammation has a significant role in gynecology and infertility, affecting the ovary, uterus, as well as the embryo and implantation. Now, many people have infections they know about, but many more have infections they don't know about. And did you know that men can have bacteria or white blood cells in the semen, or that women can have silent infections in the urinary or reproductive tracts? These infections can reduce your chances of conception and increase the risk of miscarriage without you even knowing it. Now, systemic acute or chronic inflammation can also occur as a result of infections or autoimmune issues. And inflammation is more common in people who are overweight and have poor diet. Systemic inflammation left untreated can contribute to compromised fertility. In other words, your chances of getting pregnant will be greatly reduced if you don't address it. The fourth factor that impacts fertility is the male reproductive hormonal or sperm quality issue. Now, men are found to be solely responsible for 20 to 30% of infertility cases and contribute to 40 to 50% of cases overall. Poor sperm health may be due to one or a combination of low sperm concentration, count, or volume, poor motility, abnormal morphology, or DNA fragmentation. Now, we often hear from couples who say something like, his sperm is fine, he just has low count or motility. And, in many cases, this is what a doctor or fertility specialist has said to them. I've had clients who have been diagnosed with unexplained infertility when tests have revealed that they are suboptimal sperm numbers. So the issue here is that the doctor may not know how to improve the health of the sperm. So it's easier to say the infertility is unexplained, which often points the finger at the woman. And the sperm quality is also linked to high rates of miscarriages. A 2019 study from Imperial College London found that multiple miscarriages may be linked to poor sperm quality. And finally, the fifth health and wellness factor that impacts fertility is female reproductive and hormonal issues. Now, these issues are usually quite complex and the result of multiple factors working together to trigger the fertility problem. They can include endometriosis, PCOS, luteal phase defect, blocked fallopian tubes, implantation issues, fibroids, low AMH, high FSH, and thyroid issues. And many women with these conditions have also experienced one or more miscarriages. It's possible there may be hormonal irregularities such as progesterone deficiencies, estrogen excess or deficiency, high or low AMH, high FSH, high testosterone, or androgens. All of these can contribute to ovulation dysfunction, irregular periods, or implantation issues. A 2016 study found that reproductive disorders are common in women of childbearing age and rarely occur in isolation. Inflammatory, endocrine, and metabolic mechanisms associated with these disorders are responsible for an increased incidence of obstetric complications. Now, these are just 5 out of the 15 fertility factors. If you'd like to learn more about the other 10, please join our free masterclass series, which is starting on the 25th of January, which is tomorrow. So please register below.
Okay, so I'm going to put the registration link, and I think you said it's like a limited number of seats, so it is free right now. It's starting tomorrow, and let me put this in there. Eva, that was a lot of information. I mean, you just said that was 5 of the 15. Okay, so I guess my question, if I was listening, is like, oh, I don't know how to, that's a lot of information. I don't know what personally affects me. So do you kind of help a person maybe understand what could be affecting them more? Because you looked at the digestive one was really helpful, because someone could say, oh yeah, I have had to take a lot of antibiotics in my life. I could see that would be affecting my gut health. But is there?
Yeah, absolutely. So in the first video of the masterclass series, we are focusing on the 15 factors, and we are, explaining in great detail how each individual factor is impacting the fertility of a woman or a man. And then in the second video, we share how to uncover the root causes of your unique case. So for each viewer, we will share tools on how they can see for themselves which of these factors could be actually applying to them and to their unique case. So as we walk you through the videos, and there are 4 videos in total, by the end of it, you will have a pretty clear understanding of what the potential issue may be, and you will know what to do about it.
Okay, that's great. Is there anything that you want to add? That seems, I'm hoping that you all register for that class. It sounds amazing. Register for the free masterclass series, and I put a link right there. And then would you have a couple minutes to answer any questions that come
Absolutely, in? Yes, okay. Would love to.
I mean, one thing, I'm going to speak for Dr. Eva. Sometimes with fertility or any kind of health condition, it's so complex. So when asking a question, I imagine there's no doctor in the world that would give a diagnosis via YouTube or any other platform. That would just be irresponsible. So I'm just kind of, if there's any question, I would assume you could not diagnose them on this chat. But if
That's right.
there's, okay.
Yeah, I mean, when we're seeing a patient for the first time, they fill out a very comprehensive questionnaire with 150 questions, and prior to their consultation, they can upload or send us all of the previous test results. And when all of this is analyzed prior to the consultation, which then goes for an hour, that's when we can start seeing, patterns, and we can say, okay, it looks like, you could be having this problem. We need to investigate this area more. So we may refer for more tests in particular area. We may see that there is clearly a deficiency here, so we can prescribe a particular supplement, or we can see this looks like there is a potential toxicity, so we need to investigate further. So it really is, an evolving process, and it's part of the detective work that we do to help get to the bottom of the root of the problem. And when you address that, then all of the other symptoms fall into place. So it's a different approach to just prescribing supplements or, medications that people use for each symptom they have, because that way you're not getting to the root of the issues. A lot of the symptoms that you're experiencing are stemming from the same issue. So the idea is that you find out what the root problem is and solve it at the root.
Okay. One thing that I think is a little bit confusing, and maybe you can clarify before we get to a question, is it seems like when you walk into a fertility clinic, wouldn't they assess you head to toe? I mean, you're looking for possible anything that could be causing fertility issues, but it's confusing for some couples because a lot of times they leave it and say, oh, well, they give kind of like a general type of diagnosis, like poor quality eggs, but don't ever tell them like anything that they could do to treat that, except maybe it's a maternal age factor in some cases, or the unexplained infertility, or, I mean, people feel like if I go to a fertility clinic, that's the place where they're just going to really do everything. So why doesn't that happen?
That's a great question. The thing is that even though these clinics are called fertility clinics, they're essentially an IVF clinic. So they have their box of tools that they offer. And when you walk into one of those clinics, you're being assessed for one of their treatments, which can be an IUI, IVF, ICSI, or they can also assist with donor egg cells, donor sperm cells, and they can do a few other things if there are certain anatomical issues like extracting sperm directly from the testes. So they're excellent at doing all of this, but they're not, it's not part of their paradigm to look for why you're producing poor quality eggs, or why is the man producing poor quality sperm, and then, find out and give you a prescription for various supplements and dietary and lifestyle changes, and then send you off, to try all of this for 4 months, then try naturally, and then come back to their clinic if you're still unsuccessful. That's just not how they work. They work with you then and there, and if they see that there is an issue with sperm, so it's not good enough for IUI, they may recommend IVF, or they may go all the way to ICSI, where they're injecting the sperm into the egg cell. So it's just not part of their paradigm. It's not part of their toolbox and what they offer.
Okay, that makes so much sense. Okay, so we do have a question from Gauri, 36, married in 2008, till date, no children. Shall I get conceived with a healthy baby? I'm diabetic too. Please tell about the diabetes fertility process.
That's a great question, and thank you, Gauri, for asking it. So it depends, whether you're diabetes type 1 or diabetes type 2. Diabetes type 1 is autoimmune, and you usually develop it as a younger person. Diabetes type 2 is solely related to your diet and your lifestyle. So it would really depend on the type of diabetes you have, how we would go about the treatment. If it's diabetes type 2, then you can manage it really well by adjusting your diet and your lifestyle, making sure that you're exercising regularly, which is a combination of cardio and weights, making sure you're avoiding refined carbs and sugar, processed foods, refined fats, that you're eating whole foods. Also, people who have diabetes type 2 have been shown to do really well on vegetarian diets, but it's again important that you're then not over consuming things like soy, and sort of meat alternatives, which can be full of genetically modified foods. They can be full of sugar and starches, which again would not be ideal for managing diabetes. But again, and then there are certain supplements that can help your body with blood sugar regulation, like the gymnema herb and chromium. Chromium is a very important mineral for blood sugar regulation. But then again, it depends, on what you're eating. If you're eating a big bowl of pasta and then rice, desserts and chocolates, and if your diet has also lots of dairy is not ideal either. So we would do, analysis of what you're eating, and obviously we would need to know what type of diabetes it is.
Okay, thank you. So before we wrap up, do you have any questions for Dr. Eva? Okay, and there's just, we, like I was saying in the beginning, I've never done a Facebook Live, and it looks like more people have come on than in the beginning. And I wanted to do this because Dr. Eva, if you've watched any of my videos, she really, really helped me when I was trying to conceive in my 40s. And I was saying I met her through an article that she wrote that came kind of at the perfect time. It was really a beacon of light. She talked about the preconception phase and what you could do to improve egg quality and sperm quality. And everyone that I was sort of running up against, all the doctors that I was meeting, it was all about my age and that I was older and that I should do IVF, and there was nothing I could do about my egg quality. So Dr. Eva came into my life like an angel, and she was life-changing for me. And so she's here now. She's doing a free fertility masterclass. It starts tomorrow. The registration link is above. I highly encourage you to register for that. Okay, so we have another question. Is it possible to get pregnant in your 50s? And what would a person have to do to make this possible?
It's a great question. Everything and anything is possible. It's probably not very common. There have been women who conceived in their 50s, and I believe the oldest one was in her 60s somewhere in India. But whether that's still possible, we would need to analyze your case to see where you are at. Are you still menstruating? Are you still ovulating? Are you ovulating regularly? Is your FSH still in normal ranges? What's your ovarian reserve like? Your biological age matters more than your chronological age. But if you have already gone into menopause, if you're menopausal, then with the methods that we use, it's not possible to reverse it. Maybe there is someone else doing a different method somewhere where this could be possible, or you can always consider donor eggs, because with donor eggs, conception at any age would be possible. So yeah, it would just depend.
Red Rose, thanks for such a nice program. My question is PGT necessary in IVF, or can we have IVF plus ICSI only? I'm 45, husband is 43. He has low sperm count. I was pregnant naturally last year.
Yeah, look, it's a difficult one to answer. It really depends. It varies from clinic to clinic. If there's sperm quality issues, I think it's important to try to address them, because we can address them. Men produce new batches of sperm every 72 to 76 days. And if you address all the factors from nutrient deficiencies to toxicities, you evaluate genetics, you evaluate diet and lifestyle, and you make some big changes in those areas, plus you support the sperm production with the supplements or anything else that questionnaire may uncover, or analyzing your case may uncover, then you're looking at much better chances of conception, because the egg cell is always trying to repair the sperm cells. So even if you're using ICSI, if there is DNA fragmentation in that sperm, that may not give you the best outcome. And I would say give yourself the opportunity to optimize the egg quality and the sperm quality first. Whether you then use IVF or not, you will see, because a lot of our patients get pregnant and they don't need to use IVF anymore. But if you do use IVF, studies have shown that doing a natural preconception program first almost doubles the success rates of IVF.
Chaya asks, is levothyroxine safe? I'm on it due to high TSH.
Levothyroxine is just replacing thyroxine that your thyroid should be making. So levothyroxine is T4, which is the inactive form of that hormone. Your body still needs to convert it to T3, which is the active form. And levothyroxine is not doing anything for your thyroid. It's just providing the rest of the body with the hormone that is necessary. So if you are wanting to really address the cause of hypothyroidism, then you would need a slightly different approach. You would need to, first of all, see, why is your thyroid functioning poorly? Is it because you're lacking the key nutrients that are necessary for production of thyroxine or conversion of inactive T4 to active T3? Or is it because you may have an autoimmunity? Have you ever checked for thyroid antibodies? Or do you have a toxicity? Maybe your mercury level is high. So, these are just some examples. And then once we would know why you have become hypothyroid, we would then be able to treat it. Some people become hypothyroid because they've just been under so much stress that their adrenals are exhausted. So the body will turn down the thyroid, which sets the rate of your metabolism, to give them a break. So again, each cause of hypothyroidism is different. And like I said, the medication you want, unfortunately, is not doing anything for your thyroid. It's just supporting the body, but it's not getting to the root of the problem, nor is it solving it.
But she would stay on the levo until until she had some type of care that was being managed.
Correct.
Oh,
yes.
Okay.
You never, just as a general rule, you never come off any prescription medication without first discussing the alternatives with the doctor who prescribed it. And then even if you find someone else to help you, you would still have that discussion with the doctor who prescribed, because you need to sometimes gradually come off the medication, or you need to give your thyroid enough support so your thyroid is making its own thyroxine, so it no longer needs the crutch. It's a bit like the crutches when your leg is healing. First, you can't apply any weight on it. Over time, you can apply a little bit of weight, then you can let go of one crutch, then you're just walking with one crutch instead of two, and then eventually you let go. So it's the same sort of approach.
Neosoul Writer says, I'm already registered. That's great. I'm overweight, so I'm working on my weight loss until I get to a healthy weight so I can do at-home insemination. I'll be 41 by the time I try to conceive. Well, great job with getting healthier.
Thanks,
Kristen. I'm 40, been trying to conceive since I had a miscarriage 18 months ago. I do have non-alcoholic liver dysfunction. Is conception still possible?
Yes, I mean, liver is a very resilient organ, and we would need to do some more investigations to see what contributed to your condition, and then we would support your liver function with the right herbal supplements and nutrients and the right diet. Maybe you would need to do some detoxing first. There are lots of other causes for poor liver function. It doesn't just have to be alcohol. It can be other toxins that we find in our environment and in our diet. It could also be parasitic in nature. There are lots of potential causes.
Okay, so I just want to remind you, if you've just come on, Dr. Eva is having a free fertility masterclass. It's starting tomorrow. Space is limited, so I wanted to make sure that you were able to register, and I just put the link below. Okay. Red Rose says, thanks a lot. You are amazing, Dr. Eva. That's so sweet. And she really is. She's helped so many people, including myself. So thank you. Tekka says, I'm wondering, when should a woman stop trying to conceive?
When your heart tells you so. I think that's a very, personal decision. I know fertility clinics, IVF clinics can have a different approach, and they can tell you just based on a couple of hormones, that you should look into other options. But, I believe in our body. I believe in the amazing healing power it possesses. And if you give it the right environment, it can heal itself. And that's, that's what we do. That's what we try to do. That's why we do all these different tests to identify what is standing in the way for your body to perform at its best. And oftentimes, when you go through this program and you see where it takes you, you get this sensation, okay, I've now tried everything, I've given everything I could. And then these sort of answers come spontaneously. And I think that's the only way you can go about it, because if you're choosing to close the door to one area of your life and to open up a door to other possibilities, whether that's becoming a parent through donor eggs or sperm, or through adoption, or foster childcare, or whichever path you choose, it comes from within you. It's not because someone outside is telling you that's what you should do, and that empowers you, and you're in a very different position than if you feel like something's been taken away from you.
All right. Well, I love that. Kristen just registered for the class. Thank you, Kristen. I'm so excited for you. Let's see. Any more questions before we go? Okay, good. Take a minute, register for that free fertility masterclass. I will definitely be watching it myself. And, just when I was in my 40s and trying to conceive, it's like, oh my gosh, I had to just really protect my heart and my spirit, because every time I went to go see a medical professional, it was like, it felt like a very negative experience. So then when I started working with Dr. Eva, she never made me feel like it was because of my age, just doing a deep dive into some underlying factors, hormonal imbalances, some thyroid, and then working to help me become a healthier version of myself. And it was interesting, when I turned 40, every time I would go to a doctor and do all the blood tests, they actually, those ranges are so big. So they'd be like, oh yeah, everything seems fine. But I was feeling so worn out. I gained the most weight I'd ever in my life. I was so tired all the time. So it was just so interesting how Western medicine kind of views health. Unless you're in a full disease state, you're fine, and I wasn't. I had some thyroid issues showing up in the very beginning state, adrenal. I was relying on coffee, even though I was, in the health profession. I was so tired. I was just coffee to get through my day. And, I had to make a lot of changes. I was kind of stressed all the time, and then trying to conceive. Oh my gosh, I was losing sleep over that. So I understand what you all are going through. It's, you need good people on your side. Okay. Are we anything else before we sign off? Thank you, everyone who came on.
Thank you. Yeah.
So Gauri just registered for the masterclass. That's great, Gauri.
Thank you, Gauri.
Okay. Well, thank you, Eva. That was fun. Our first
Thank you.
YouTube live. And people showed up. I'm so happy. I was like, maybe there's going to be one person. I have no idea. I've been a little bit MIA from this YouTube channel, but I think about you all the time, and I do have some videos coming out. So thank you for showing up today. It means a lot.
Thanks, Charlene. Thanks for having me, and thank you, everyone, for showing up. And I can't wait for you to start the masterclass.
Okay, thank you. Bye-bye, everyone.
Thanks. Bye, everyone. Bye-bye.